I'm Dr. Catherine Noonan. I'm a board-certified pediatric physical therapist, a professor at Campbell University, and I'm a mom. If you're like me, your days are busy. You're changing diapers, making breakfast, prepping dinner, slamming coffee, dropping kids off at daycare, and racing to work to put in a full day there, only to race home and do it all again. Or perhaps you're caring for children at home. You've got quality time in abundance, but you're also flying solo, and you'd love to have an adult conversation once in a while. Or perhaps you're a child care professional. You work hard every day to provide the best education possible for the children in your care, all while trying to keep yourself healthy too. Either way, the Campbell Car is for you. Because no matter who we are, we're all trying to do the same thing. Give our children the best life possible and keep them healthy. So what is the Campbell Car? The Campbell Car stands for the Campbell University Childcare and Activity Resource. These videos are designed for anyone caring for children. In these videos, we'll cover topics like child development and how to keep kids active and healthy, both in the classroom and at home. We'll also talk about ways to reduce stress and improve health in families and for childcare professionals. We're glad you're here. Now let's hop in the Campbell Car and see where it takes us.
Hi, I'm Liz, a student physical therapist at Campbell University, and this is Campbell Car. So let's talk a little bit about what pediatric physical therapy entails. Early intervention is a state-run program to ensure that NC children receive adequate supportive resources for proper development. A referral for early intervention PT can be made by a pediatrician, a PT, a speech therapist, or another healthcare provider. These medical professionals do not need parental permission to refer children to this service, and parents can self-refer by contacting their local children's developmental services agencies, which can be found at a link that will be provided at the end of this presentation. The evaluation and service coordination is at no charge to the parents, and services to children will never be denied because the parents cannot afford it. You may be wondering if your child is eligible for EI services. To be eligible, a child has to be less than 3 years old and demonstrate a developmental delay or have an established diagnosis, as in from their physician. Developmental delays can include cognition, physical delays, communication issues, or social and emotional issues. After the free evaluation, the healthcare team and family will decide whether our skills are needed, or if maybe the child needs something else, or if the child is just fine. Physical therapy takes place in the child's natural environment, so their home, daycare, or wherever the child spends their time. So, if your child qualifies, what happens after they turn 3? Once a child turns 3, they are no longer eligible for EI services. The transition out of this program begins when they're about 2.5 years old. The parent can then decide if they would like to continue services by self-pay or by billing through insurance. Or the parent could choose to receive services through state school system preschool. This is free of charge, or Medicaid can be billed with family permission. To be eligible for state preschool in NC, the family income must be at or below the state median income, have documented risk factors that would make continuation of services necessary for proper child development, or if the child has a parent that is active duty, injured, or a deceased service member. If the child is not state preschool eligible, the parent should ask their current provider for a list of other resources for their child, and with parent permission, referrals can be made to relevant community agencies and healthcare providers. At the end of this video, information links will be provided. So, what do PTs do in the school setting? Physical therapists in the school system work hand in hand with a team of educators, including speech therapists, occupational therapists, gym teachers, adaptive education teachers, and others, to provide an accessible, nurturing, appropriate, and educational environment for children with developmental disabilities. We restore, maintain, and promote physical activity. We work with the team to address any impairments, activity limitations, or participation restrictions. A link will be provided for further information for families on how to access PT in the school system. Many informational sheets found on the provided website are in English as well as in Spanish. Use the Find a PT website to find PTs near you. You may find a PT for your child with a PCS beside their name. This means that they are a board certified specialist. However, not every pediatric PT has this certification. PTs are also found in hospital settings for children from birth to adolescence to help assist children with developmental issues and mobility issues related to illness or injury. PTs also work in outpatient clinics to help children recover from injury, including sport-related injuries, and progress in their development. PTs can specialize in particular diagnosis or populations. Thank you for watching this installment of Campbell Car.